And then you can see sleep disturbances, anxiety and depression, brain fog. This is a big one. When we were in mold, my wife couldn't finish a sentence. You know, in her 40s, demented, unable to finish a sentence. Imagine, you know, you ever try to communicate with somebody and you're trying to play the guessing game of what they may mean, what they're trying to say, and how frustrating that can be for both individuals, because the one can't communicate and the other can't guess. Joint pain, headaches, especially migraines, visual migraines. One of the easiest access points for mycotoxins is your eyes. Your eyes are an extension of your brain. It's part of your brain. And you know, there's a visual contrast sensitivity loss that occurs for a lot of people in mold, which you can buy visual contrast sensitivity tests online. They're not definitive for mold because you can lose visual contrast for many reasons, but it's a good litmus. But headaches, anybody ever have a visual migraine here? Where you have visual scotomas and kind of blinking like lights that are blurring and disrupting your ability to see? Those are super common in mold. Other things that we see. This is a big one. Nutritional supplement intolerance. Because a lot of people that are sick, they're trying to pound the nutrition. They're trying to get vitamins in. I got to get better. I need to take my vitamins. Or I need to detox. I'm going to do a detox in January. And so they become intolerant because one of the things you want to understand about mold toxins is they're fat-soluble toxins. So what do fat-soluble toxins like to do? When you're bombarded by them, your body likes to shove those fat-soluble toxins into fat cells, right? Because if those toxins are circulating in your bloodstream, they're doing damage to your tissue. So your body's wise. It says, get that thing in a fat cell and get it out of the bloodstream. Let's stop the damage. So if you're living in mold, you've been shoving mycotoxins in your fat cells for however long you've been in that mold. And then you try to start taking some glutathione or some N-acetylcysteine or some methylated B vitamins. And guess what your body starts doing? It starts mobilizing those toxins out of fat cells. But the problem is you're still being exposed to those toxins from your environment. So now you've just amplified your exposure. And so you feel awful when you try to take supplements to try to improve your health. We see dizziness and vertigo, tinnitus. This is a big one here, burning or metallic tongue. And that can be mercury too. Oftentimes mercury toxicity can lurk this way as well, but mold can really affect the cranial nerves. And so metallic taste of the tongue and loss of smell. We see both weight gain and weight loss. We see weight gain in some individuals. I gained 25 pounds in mold of pure fat. Just pure fat. Crying every day, couldn't keep the weight off, cherry angiomas popping up all over my skin. Yet I have patients who are wasting away. You know, and it's everybody's a little bit unique and different in the way they deal with it. But some people, when they're overexposed to inflammatory agents, their cortisol levels go up super high, and cortisol causes weight gain and muscle loss. And so they gain a lot of weight, at least initially. PANS and PANDAS. These are pediatric, neuropsychiatric, and neurological disorders that are on the rise. Skin rashes. This is a big one. I showed you the pictures of my son. But we see a lot of atopic dermatitis that is generally labeled as either atopic dermatitis or eczema. If you've got an atopic dermatitis diagnosis or an eczema diagnosis and you don't know why, think food first. Change the diet. If it's not going away, it's most likely mold. And then behavioral problems in children. Especially, we'll see a lot of aggression in kids. Okay. So one of the problems in this arena is that it's unethical in today's day and age to do studies on humans to determine symptomatology of mycotoxin poisoning because it would be considered hurting them, right? It's unethical to give somebody a poison to measure a side effect. So the only way we can do human research is we have to do research after the fact, or we have to get doctors together to collect data. And then you have to do retrospective research, and that's hard to do. It's hard to get doctors to coordinate together. But there's these really good studies that came out of this Finnish cohort. And so you can see here a plethora of mucosal irritation. What is mucosal irritation? You have mucosal sinus. So it's here. Your GI tract lining is mucosal. The lining of your lung is mucosal. The lining of your kidney tubules is a mucosal lining. So there are a number of different types of mucosal linings in the body. So when we say mucosal irritation, it's all those areas. Neurological disease, skin, allergies, and other symptoms, with all family members ultimately developing a multiple chemical syndrome or multiple chemical sensitivities. That's where they can't handle scent. So if somebody's got a Glade plug-in, if somebody puts on perfume, these people are wrecked. Migraines for a day, maybe a week, because their body is so overwhelmed and bombarded, they can't handle chemical exposures anymore. A greatly elevated prevalence of autoimmune conditions and malignancies, mold-related illness exists in multiple facets. I said earlier, it's a hydra. It tricks doctors who don't know what they're looking for. And again, it's not to pick on medicine, because I think there's a lot of wonderful things in medicine, but I think one of the worst things that's come out of medicine is the pharmaceutical control over the decision-making paradigm of how doctors do things. And what you get is you basically get symptomatic treatment with drugs as a solution to everything. And that's not helping, right? The US is the unhealthiest country in the world as it relates to industrialized countries we spent $4.2 trillion last year. And we don't have less heart disease, we don't have less cancer, we don't have less autoimmune disease, we don't have less diabetes, we don't have less obesity. We have more surgeries, and we have more expense on medications than any other country in the world, by far, vastly, yet we're the unhealthiest of those industrialized countries. What does that say? It says that drugs for symptoms, I hope it's a dying paradigm, although we'll find out, we'll see. At any rate, human studies. So these are human studies, so I want to just point that out. We know this is done on humans. So most of the research and most of the argument, those of you litigating court cases, a big part of the argument is, well, there's no evidence in humans. This is evidence in humans. Any attorneys in the room, get a copy of this. Use it. And you got mold exposure and neuropathies. So you can see this is again humans. Patients with documented measured exposure to molds have elevated titers of antibodies, and in this case IgA, IgM, and IgG, to neural-specific antigens, meaning they're producing antibodies against their own nervous system tissue. So you can see and this is a small study, 55, but you can see 2 develop motor neuropathy, which basically means weakness in muscular issues. 3 develop sensory neuropathy. That's like the numbness and the tingling or the burning syndromes. And then 4, those with symptoms but no neurophysiological abnormalities. And then all groups showed significantly increased autoantibody titers for all isotypes of antibodies to neural antigens when compared with 500 healthy controls. What does that mean? That basically means that people in mold developed immune responses to their own nervous system tissue. This is why people in mold have brain fog. They're having nuclear atrophy in regions of their brain as a result of chronic autoimmune responses against their own nervous system tissue because they're being exposed to mold. Here's a couple of newer studies coming along with neurological. So can low level of exposure to ochratoxin A, which is, ochratoxin A is a mycotoxin produced by Penicillium and Aspergillus molds. You know, it's funny, a lot of times they'll say, oh, Penicillium and Aspergillus, those aren't the harmful ones, it's just black mold. That's BS. These guys produce ochratoxin A, super dangerous chemical toxin. They're finding Parkinson patients with high levels of ochratoxin A. Here's another one, detection of mycotoxins in patients with chronic fatigue syndrome. This was the doctor in Dallas I was referring to earlier, Dr. Joseph Brewer. And you can see 93% of patients positive for at least one mycotoxin. So let me show you some clinical pictures. These are actual patients. You can see this here, the yellow. I don't know how well this is showing up in the dark room here, but this is mold. This is mold colonization of the nail beds. That's what it looks like. And you see the skin, how torn it is? It's infecting the skin. This is a lighter example. So what I just showed you, this is pretty severe. Okay, not everybody's just going to show up one day with this. This is years of exposure and immunosuppression. This is more kind of common of what you would see. So you can see skin looks okay here, but you can see that not only the nails discolored and have yellow undergrowth, and if you took a scraper underneath that nail bed, it'd be all kinds of white powder coming out of that nail bed. That's mold. And then you can see in the fingers. You can see at the tip, you see how that nail is misshapen, but you got white all along the tip here. That's not normal, that's mold. This was a young kid in mold that came to see me. Pretty obvious. Doesn't always look that bad. Again, you see the tip of the tongue, how that's white and discolored? That is what a lot of people in mold will look like, not that. This is pretty advanced. So you might not always see that, but very commonly you'll see something that might look like the tip of that tongue. As mentioned earlier, mycotoxins can mimic estrogen. So this was a study recently done here in the US on pregnant women. And so what they were trying to analyze concentrations of this particular type of zearalenone, which is, again, it's a mycotoxin produced by Fusarium. But they were looking at pregnant women, and you see mycoestrogens were detected in 97% of urine and 84% of placentas. You see consumption of ultra-processed foods. I want to just sit here. I want to park it right here for just a minute. Ultra-processed foods contaminated with mycotoxins. So if you're eating processed foods, not just grain, but ultra-processed foods, you're exposing yourself potentially to mycotoxins. Key takeaway from that is eat real food. Now, the second key takeaway from that is if anyone in here is either recommending urinary mycotoxin testing, or if anybody in here is getting ready to have urinary mycotoxin testing, you need to be off of ultra-processed foods. You need to be off of grain. You need to be off of alcohol. You need to be off of coffee. You need to be off of peanuts for at least 2 weeks before you submit a sample. If you're not, you could get a false positive on your sample, and it might take you down a rabbit hole that you don't want to go down. Now, if you're litigating a case, any lawyers in the room? No lawyers. Well, maybe they're watching. If you're litigating a case, this is going to be the defense of the other side. Well, those mycotoxins aren't from your house. This person eats like garbage, and there's studies like this that show that there's mycotoxins in food. That's why it's so important to make sure you collect it properly, especially if you're going into litigation. You don't want to give the other side any room to negate your positive results as it might relate to you being poisoned by your house versus you being poisoned by your diet. Make sense? Okay, so here we have, this is what I was just talking about, fungal toxins and host immune responses. Cereal grains, nuts, spices, apples, dried fruit, coffee beans, all can contain mycotoxins. It's estimated that 20 to 25% of food crops worldwide contain mycotoxin contamination, while mycotoxins and mycotoxin-producing fungi are frequently isolated from construction materials and air samples from water-damaged buildings. So it can come from both places. So it's just important to know that so that when you're going to get testing and you're maybe battling a legal case, that you get this part right when you're doing your samples. So again, simple short list here: grains, peanuts, coffee, alcohol, dried fruit, ultra-processed foods. Okay, I was talking earlier about, this is kind of a complex slide, and I'm not going to spend a lot of time here, but I wanted to point out a couple of things out. This is in relationship, you see up here ERA, ERB, that's estrogen receptor alpha, estrogen receptor beta, that's what that stands for. Now, I told you that there are mold toxins that can mimic estrogen. And so when these mold toxins bind to these receptors, you get mast cell aggression. Mast cells are the cells that make histamine. And this is another mechanism of histamine overload in people that are being exposed to mold. I told you earlier that IgE responses are responsible for the release of histamine, and that's an allergy to the mold itself. This is not an allergy to the mold. This is the mold toxin behaving like a hormone that differentiates your immune cells into more mast cells. And so you get what's called isotype switching and IgE antibody formation and mast cell degranulation and production of cytokines. Mast cells, when they degranulate, basically that's like a big immune cell just opens up and it releases all this chemical, and all this chemical has consequence when it's in high amounts. So let's look at some of those consequences. This diagram is a little washed out, but these are symptoms of histamine intolerance. And so you can see rhinorrhea, or runny nose, rhinitis, inflammation, nasal congestion, and dyspnea, which is shortness of breath. You get gut symptoms: bloating, flatulence, postprandial fullness, diarrhea, abdominal pain, constipation, nausea, vomiting, headache, migraine, dizziness, tachycardia, so your heart rate goes up, hypotonia, and then collapse or fainting. Ladies, you get excessive menstrual cramping, so aggressive cramping, pruritus, flushing, urticaria, dermatitis, and swelling. These are just symptoms of high levels of histamine production, which if you're in mold, if you're allergic to the mold, you can get this, but if you're in mold and you have a lot of Fusarium mold, you can also trigger this through receptors, estrogen receptors. This is another example of a patient in mold. This guy was in some of the worst mold I've ever seen. He flew all the way from Australia to come see me. But you can see what's happening here to his skin. It's swollen, but it's also cracking. And that's why it looks like these alligator fissures that you can see. And you can see the leg here, how the skin is just peeling and stripping away. Let's see here. Zea is an estrogenic mycotoxin, which is common food contaminant and has been implicated in increasing the incidence of carcinogenesis, that's cancer, and other reproductive health ailments through the estrogen receptor alpha pathway. So just, again, when you have excessive chemical estrogen, you expose or predispose yourself to the development of breast cancer and uterine cancer and other types of estrogen-related cancers. And so how many women go in and get hammered with either surgical removal of their breast, and then, generally they want to do radiation and chemo, and then after that they want 5 years of tamoxifen. And tamoxifen is a selective estrogen receptor modulator drug that is supposed to reduce the risk of a future estrogen-related cancer, but the problem with that type of medication is it also causes autoimmune disease. So that's what I mean. You're damned if you do, right? So you need to figure out why that stuff happens, and if it's as simple as mold in your background environment in a big way, you've got to address it.